Thank you so much for joining us today for Let's Talk SDOH. And we're here with another great guest from the SDOH network, and that's Dr. Michael Compton. Dr. Compton, Michael, how are you doing today?
I'm doing great. How are you, Kimberly?
I'm doing great. It's another beautiful day, I know it's a great day where you are. I love the bridge and the background, and I really appreciate you being here talking about this really important topic. And
Thank you
we
so
thank you.
much for having me.
So I do want to just dig into this concept, food insecurity, now that I've introduced you to everyone. Tell us more about yourself and how did you get involved with the Social Determinants of Health Network?
I'm a psychiatrist. I'm trained as a community psychiatrist and a social psychiatrist, which means although I used to see patients on inpatient units and outpatient clinics and prescribed medication and did psychotherapy, right now my focus is really on the social aspects of mental health and the things that go on within our society that impact mental health. And so I have a special interest in what we call the social determinants of mental health, or the drivers of mental health that are really rooted in societal problems and policy issues. And back in 2021 and 2022, I had the real privilege of serving on Dr. Vivian Pender's APA, American Psychiatric Association, Presidential Task Force on the Social Determinants of Mental Health, along with 11 other members. And from that work over the course of a year, Dr. Dilip Jess created the Social Determinants of Health Network, which is really meant to create a forum for those of us who are really interested in the social determinants of mental health and to have webinars and those sorts of activities. So I'm delighted to be on the advisory board of the Social Determinants of Health Network.
Awesome. Great. And we've had Dr. Justy on here, and we've worked with Zoomcatchers has worked with Dr. Justy on some other projects. And so we're really excited to be a part of getting the word out and the importance of the social determinants of health in general. And before we dive into your expertise and your specialty, which is food insecurity and nutrition, can you just give maybe new viewers or listeners an overall understanding of what are social determinants of health?
So this is really a population level concept that grew out of the field of public health. It's about socio-political and structural factors. These social determinants are really societal problems, and they're important for mental health because they do four things. One is they impede our ability to achieve optimal mental health. They also increase the risk and prevalence of mental illnesses and substance use disorders in the population. Among people living with a mental illness, they worsen course and outcomes. And finally, the social determinants are responsible for really creating mental health disparities or inequities. And so since these are societal problems, they need to be addressed at the population level through two things. One is public policies, like legislation, for example, and the other is social norms, which is really how, one group thinks about another group. So the social determinants is really, as I said, a public health or a population-based approach. The primary goal here is about prevention, but the social determinants obviously also impact individuals. And so in the clinical setting, mental health professionals like myself, we can think of the social determinants as social adversities among our patients, and we can try to address those social adversities with our patients. The goal might not necessarily be prevention here, but the goal is that it's part of treatment. It's about improving outcomes and reducing disability among our clients.
hmm Awesome. Great. Thank you so much for that. And then let's, get deeper into the whole topic of food insecurity. I know a lot of people have heard of it. I know they know food and they know insecurity, but when you put those together, can you just explain to us what exactly is food insecurity and how common is it in the United States?
Yes, Thank you for that. We all need to be aware of the problem of food insecurity. You know, it used to be referred to as hunger. The more common term now is food insecurity because many people struggling with food insecurity aren't necessarily hungry per se in terms of having that, you know, uncomfortable physiologic sensation because you have no food in your stomach, but rather it's a difficulty accessing enough food, especially enough healthy food. Let's think about it like this, Kimberly. Imagine that you're a single mom, you've got 2 young kids at home, it's Tuesday night, payday is not until Friday, and you need to feed your kids. You open the fridge and it's pretty much empty. How's that going to make you feel as a mom? It's going to make you feel frustrated, sad, embarrassed, angry, disempowered, ashamed, hopeless, guilty, depressed, right? These are not good for your mental health. These emotions are not good for your mental health of mom or the kids. That's what food insecurity really is. It means not being sure that you're going to have enough food to last to the end of the week or the end of the month. Now, there are more formal definitions from the WHO, from the USDA, et cetera. And every year, the USDA, the U.S. Department of Agriculture, conducts a large-scale, nationally representative survey to measure food insecurity in the United States. And it's usually around 11%, 12% of U.S. households who are food insecure. That amounts to 15 million households in the U.S. who are food insecure, not being sure that they're going to have enough food to last to the end of the week or the end of the month. And I would also point out that the rates of food insecurity are not stable across the states, but rather there's a lot of variability in the rates of food insecurity across the states, ranging all the way from about only 7.4% in, for example, New Hampshire, all the way up to nearly 19% of the population in other states, like Arkansas, for example. And so there are policy decisions that are being made at the state level that impact the prevalence of food insecurity.
Thank you so much for going over that because I think, like I said, a lot of people have heard of the term, and clearly everyone is impacted by food and the amount of food they either have or don't have. So I appreciate you going through that. And would you say then that the issue with food insecurity is getting worse, or is it better, or is it about the same? Let's say over the past decade, what is the trend there?
Well, it does vary a bit from year to year, and it varies more drastically when there's something big going on in society, if you will. So, for example, back in 2008, during the so-called Great Recession, there was a spike in the rates of food insecurity. Then things gradually stabilized. In 2021, we see another spike in the rates of food insecurity, which coincided obviously with COVID-19 and people struggling with losing their jobs, et cetera. And so although it tends to be relatively stable over time, 11, 12, 13%, there are occasional spikes at the national level up closer to about 14 or 15%.
Mm-hmm. Great. And then, I do want to talk a little bit about what you just mentioned, and that was access to food. And if you can explain that, because, we're right here in California, the salad bowl of the whole country, people go out and they see stores, they see food. Why exactly is access so much of a problem for a lot of people?
The WHO says that food security is built upon 3 pillars in society. One is food availability, one is food access, and the other is food use. So in the United States, as compared to low-income countries like sub-Saharan African countries, where the real problem is food availability, in the U.S., The problem is not one of food availability. We have actually more than enough food to go around. The issue of food use also tends not to be the problem in the U.S. If people are able to get access to healthy food, they're usually able to eat it in a way that's safe. The real problem, as you pointed out, Kimberly, is food access. We have a market failure, really, a policy failure where the distribution of healthy food is unequal, and it's distributed in an unequal, unfair, unjust way. Some people are able to access healthy food and others aren't. And when you have very limited food dollars, it changes what you eat.
Yeah, I can think of just some examples in my own personal life. I was teaching at a public elementary school for a couple of years during the pandemic, and for me to get a healthy lunch just based on what was around me, it was a real challenge. And it was something that a lot of people discussed as well. And it was just real clear to me, just based on those experiences and what people were saying, that it's like, yeah, there's the food, but the food choices weren't exactly healthy and they weren't exactly nutritious. And I did want you to speak on nutrition because I think people think food and nutrition are the same thing. And I imagine that they're not. So if you could talk to that, that'd be great.
Yes, so a few thoughts in this area. One, related to what you just mentioned, you know, some people live in what are so-called food deserts. Those are geographic areas like census tracts or neighborhoods where access to healthy food is very limited. And so people might be, forced, if you will, to make food choices at the corner bodega, at gas stations, etc., because there's just not easy access to healthy, nutritious food. And coincidentally, many of those food desert census tracts are also considered food swamps, which means there's more than enough food. It's just of a particular type. It tends to be junk food and fast food. And so in mental health, we know that many of our patients actually live in these areas that can be considered food deserts and even food swamps, which again changes how people eat. And so to your comment about nutrition, nowadays we're thinking more and more not just about food insecurity, but about nutrition insecurity and nutrition security. And so there's a shift of just rather than focusing on the amount of food that people are able to access, to also think about the quality of that food. Because we know that many people with food insecurity struggle also with nutrition insecurity. As I mentioned, limited food dollars means you're going to buy the highest calorie, most energy dense foods, and those tend to be less healthy foods, comparing ultra processed foods versus fresh produce, for example. And so we're thinking more and more about this concept of nutrition security.
Hmm. Great. Thank you so much for that because just, it seems like when I was growing up, there was this really big focus on caloric intake. And I don't know if it's the same, but as far as those kinds of trends if you could speak to those kinds of trends, is there more of a push for, obviously we need a certain amount of calories, but is it an emphasis on, like you say, high quality intake versus just the caloric number?
Yeah, historically, hunger and food insecurity focused, as you said, on caloric intake, making sure that people get enough calories so that they aren't malnourished. But with food insecurity in the present food environment that we live in, food insecurity is commonly related not to underweight and malnourishment, but actually to overweight and obesity and risk for diabetes and increased risk for cardiovascular disease, again, because it shifts what one eats. It changes diet quality. So, what starts as a financial problem becomes a diet problem because it really changes how one eats. And then, of course, that leads to medical problems, and it also increases risk, for mental illnesses.
Yeah, it just feels like, food is just it's one of the one things we have in common, everyone needs to eat. And I think, you know, not to knock anyone or bash people, people are doing the best to put food on the table and provide what they consider nutritious meals for their family and for their loved ones. And, what sort of advice would you
Yeah.
have for the general public regarding, nutrition and food, just kind of going forward so they can have a better understanding of how the food that they're giving to their families or eating themselves is really impacting their overall health and mental well-being?
You know, we have to place choices within the context of environment and what are the choices that we have available to us. And so a typical trip to the grocery store means that the vast majority of what's in the grocery store is processed food and ultra processed food, much of which would not be considered healthy. And so, I think most basic sort of nutritional advice is to minimize, reliance on ultra processed food to the largest extent possible. And it's very, very difficult to do because, as I said, we live in an environment of ultra processed food. So, a few pointers, if you will, or diet advice that not everyone can follow, but maybe try to embrace one or more of these. I'll give you a handful. One is that, if, a packaged food has nutrition facts label on the back of it, read that label. It's there for a reason. It's there to inform us about the healthfulness or lack thereof of the packaged and ultra-processed food. Also, read the ingredients list. A really sort of simple rule of thumb is if included in that ingredients list are some things that you can't pronounce or that you don't have in your pantry, try to look for some other option that's not ultra-processed food. Some other pointers, one is, for health, minimize saturated fat and maximize fiber. What does that really mean? Minimize meat and maximize vegetables. It's very clear from the research that that's a healthier way to eat. Another sort of pointer is if you eat meat, replace some of it with plant-based complete proteins, as we call them, complete proteins that are plant-based. This means combining legumes with grains. So a good example is combining beans with rice. That's a complete protein, beans with rice. Just as good as, a chicken breast. Another example is hummus and pita. Again, a complete protein that's plant-based. And finally, another example is peanut butter on whole grain bread. That's a complete protein. So it gives us all that we need in terms of protein. A couple of other pointers. One is to replace white bread with brown bread to the extent that you can, especially brown bread that has visible seeds in it. And so let me give three more pointers for nutrition, wearing the hat of a farmer this time rather than a doctor. One is to get smart about vegetables. There are so many vegetables available to us with so many different and delicious tastes that we need to really get smart about our vegetables. I would also recommend to eat local and organic to the extent possible. I know that it's not always possible or easy or even affordable, but I do recommend as a farmer to eat local and organic as much as possible. And finally, here's one, grow some of your own food. It's the very healthiest food if you grew it on your balcony or you grew it in your backyard.
Mhm. Great. Thank you so much. And we're here with Dr. Micheal Compton talking all about food and nutrition. And those are great points. And I really want to drill down on some of those because, there's obviously an audience just for one audience is just the general public. Everyone needs to eat, and we understand that. But what is your advice to, let's say, producers of food? I mean, you're a farmer yourself, so you've had that experience of actually producing food as far as getting this higher quality food into neighborhoods and communities maybe that haven't seen that. What are some recommendations that you would have on that that point. It's like, yeah, we all want to eat great food, but how do I get it and where do I find it and how come it's not in my neighborhood?
Yeah. Well, I think, Kimberly, it partly depends on where you live. We have a very, very large country with very different terrains and geographies, et cetera. So it partly depends on where you live. Where I live in the Hudson Valley, I'm surrounded by small farms and orchards. And so it's easy for me to get to know a local farmer and to buy nearly all of my produce, except for some exotic fruit like bananas, for example, from local farms right here in the Hudson Valley. And there are many parts of the country where we have that great opportunity to get to know a farmer, sign up for a CSA, community supported agriculture, where you buy a farm share and you get your produce from the local farm. It's going to taste better, it's going to be more nutritious, and it's going to be fresher because it hasn't been, in an 18-wheeler coming across the country from beautiful California to lovely New York, where I can buy my produce here in New York and you can buy yours in California by getting to know a local farmer. And I know that that's not always possible depending on where you live. Um, you know, Produce from the grocery store is healthy and nutritious. It's just not quite as fresh and nutritious and ripe as you would find, from a local farm source. And this is also true for dairy and meat products as well. Get to know a farmer.
I love that. Come on, okay, farmers, it's time you guys band together, guys and gals band together and promote yourself. And I think, especially now with all the kerfuffles with the tariffs and trade embargoes, I think now more than ever, people. Last time I was at the store, which was just a couple of days ago, the stores were packed with people. I think really trying to get their secure their products now. Look at see what the prices are. So, what do you have to say in that regard as far as the issues with trade and the food commodities?
Yeah, it's frightening, isn't it? Much of the produce that's in the grocery store is in fact trucked in either from, the large growers in the US or even from outside of the country. And so we're at risk right now for seeing prices to increase on produce. But as I mentioned, some produce can be purchased locally. It's going to be different because you're not necessarily going to have access to the same vegetables year round. Local means seasonal. And so, we're going to, if you really embrace the culture of eating locally from small farms, you're going to eat tomatoes in some months, but not other months. You're going to eat snow peas in some months, but not others. But that's part of the local food movement is that it's seasonal food.
I remember back when I was a young lass where that was the way food was. It's like I grew up in New York, so there was food you had in the winter and there was food you had in the summer, and now it's you can get summer fruits and vegetables all year round, which is
Yeah.
definitely interesting and progress in obviously a lot of ways. But in some ways, it puts people at a disadvantage when there's all kinds of trade issues and tariffs going on that affect the food supply. So, and are you noticing any, just as far as your network of people in this industry, are you noticing any actions that they're taking in response to what's going on?
I do think that some communities are really trying to bolster farmers markets, CSAs, community supported agriculture, and farm stands to really help people have better access to, as I mentioned, local and seasonal food, because there is worry among both farmers, but also among consumers in terms of what this is going to look like. So if we see fewer avocados, maybe that means we eat more heirloom tomatoes, in the peak of summertime.
Yeah, it's definitely interesting, and I think it's though a great time to be having this conversation because there's opportunities and everything, and maybe local farmers and farmers markets need to really get out there and push for more of those. Because I imagine even if you are a local food producer, your costs still may go up because you're getting what raw materials and raw resources are, but still may be sourced from other locations. Is that correct?
Yes, yes, I think so, yes.
Mm-hmm. Awesome.
I would also point out that organic farms have fewer inputs than what are called conventional farms, which is a really bad term for non-organic farms. And so fewer inputs means organic farms don't use pesticides, they don't use herbicides, they don't use synthetic fertilizers. Many of those inputs coming from across the country or across the border. And so organic farms are especially situated in that they have fewer inputs and thus a lesser need for the very products that you just mentioned might be coming from abroad.
And thank you for that because I think, there's a lot of misunderstanding around that label, that term organic. So if you can just break that down, what exactly does that organic certification mean?
Yes, it is a special certification that is sort of prized, if you will, in the farming community because it does come with a higher bar in terms of how you care for the soil, how you grow your plants, how you weed, how you deal with pests like bugs and other critters. And, my organic farm gets inspected every year. They come and they look at my receipts, where I bought my seeds, ensuring that those seeds are organic certified, my soil care practices, how I weed, how I, dispose of plant material, what my compost pile looks like, the kinds of products that I use on the farm, and ensuring that I don't use herbicides to kill weeds, pesticides to kill bugs, and synthetic fertilizers. So the organic certification, that word organic, does really mean a lot. It means that the farm is being held to a higher standard in terms of federal rules and regulations.
Thank you. I really appreciate that because my 94-year-old aunt was convinced it was a scam, and I'm like, no, it's not. So I'm glad you went through that. So it's a pretty rigorous certification, huh?
Yes, yes. There are some groups that believe that the standards could be tightened even further by, for example, disallowing hydroponic growing. But, the standards are there. Most organic farmers agree with those standards. Some of us think that they could be even bolder. But nonetheless, in general, organic produce is going to be healthier in that it has fewer pesticide residues.
So, based on, let me make sure I'm understanding as far as the nickels and pennies related to the cost. So, I mean, because you said previously that organic food products are going to have less inputs. So, does that mean necessarily then that they're going to be lower priced than an equivalent conventional product, or not necessarily?
Ironically, it's not necessarily that the organic produce would be less expensive. The reason is it's a bit harder to grow produce organically without using synthetic fertilizers, for example. There is also the cost of maintaining certification. There's a lot of bookkeeping required, a lot of paperwork required, and so that comes with some cost. Um, but growing food organically is not necessarily less expensive, even though you're not using those chemical products.
And I think, it really comes down to probably an investment in your own health. It's like, are you willing to spend the same amount of money or maybe a little bit more for a product that doesn't have chemicals that are carcinogenic or have ill effects on your mental and overall health? So I think everyone should weigh those. But I get the impression that one of the things that's needed is just better education around food and nutrition. I don't know what's taught in schools. I remember in school, we had nutrition classes and we had to actually cook we had classes, we had to participate in that. Where do you fall in on that as far as the education level the education effort that may need to happen as well?
Yeah, I agree completely with you. We need more nutrition education. I don't even know if home ec classes exist anymore. But definitely, I think we would all benefit from more nutrition education, primarily because of the food environment in which we live. It's easy to just rely on ultra processed food. And so I think the more education that we can do, the better in this area, given, the food environment.
So more education, better understanding, because I think, you know, with the proper education and understanding, people are going to make good choices, but they may not necessarily be aware. A lot of times, like I said, they're in situations, they're at a work location, they have to eat what's around them. They don't have an hour to go get food, or they have to bring food themselves. So there's a lot to think about. And when you're hungry and the hunger pains are kicking in, you're going to grab something that's convenient, right? So I think convenience
Yeah.
is a big driving force. But I do want to talk about, as we're talking about health and nutrition, the idea of food as medicine. I know there's a big movement around that, and I think for some people that may sound obvious. Well, of course, food is medicine, but what exactly does that mean?
Food as medicine is really, it's an emerging concept in the healthcare field, believe it or not, that posits that people need to eat really healthy food in order to address their health concerns. And so food as medicine is being rolled out in a lot of large health systems and a number of insurance companies. And it's really about three things. One are so-called medically tailored meals, where people with serious physical disabilities who aren't able to prepare their food are delivered food that's medically tailored to their own physical health needs. Another is called medically tailored groceries. And then finally, there are so-called produce prescription programs that are part of the food is medicine movement.
Wow, that's fascinating. You really perked my ears. Let me drill down on that. So you're telling me that the insurance industry is actually behind some of these initiatives where food is being prescribed for certain particular diseases and illnesses, or how exactly does that work? Are they getting it from nutritionists or their general practitioner?
Yes, that's right. All of the above. So now registered dietitian services are being covered more and more by insurance. Some insurance plans are covering food as medicine to actually prescribe or provide people with healthy, nutritious food. There's a movement also within Medicaid across a number of states that are carrying out what are called 1115 demonstration waivers so that they can actually rework their Medicaid program to focus on not just paying for hospitalizations and medications and doctor's appointments, but things that we refer to as health-related social needs. And one of those health-related social needs is healthy food. And so there are Medicaid programs in a number of states across the country that are now providing people through Medicaid with healthy, nutritious food.
Well, that's exciting. That's great to hear. I mean, it kind of makes me think of like Meals on Wheels. I was a caregiver for my aunt, and we had Meals on Wheels for her for about, I think, 2 years. And so that food was delivered, and it was, they had a menu so you could see what was coming every month. Is it a similar type of rollout like that, some type of delivery service?
It is very much. That would be what is referred to as medically tailored meals that are delivered. And then, as I mentioned, there are also medically tailored groceries where you get groceries and then you're able to go ahead and prepare your meals.
Wow, a lot of exciting things going on in the food
Yeah.
industry, and I did want to ask you if you could talk more about food banks and pantries now that we're on the whole topic of distribution of food.
Sure, I think it's an important distinction that people should be aware of. Food banks are regional warehouses located across the state in all states. They're large warehouses where there are large amounts of mostly shelf-stable food that is stored there in the food banks. The food banks are then usually responsible for distributing that food to local food pantries. And food pantries are the places where one can go and actually get, free food. They're commonly in, a church basement, a community center, et cetera. Maybe they're only open on Tuesday nights from, 6 to 9. But the food pantry is the local place where people can go and get free food that is distributed by the food banks and also to some extent by local community members and even local farmers who provide some food pantries with fresh produce.
Excellent. And so if someone's watching or listening, if they want to find out more about that, they can just do research online, just Google search those types of places in their area.
Yes, Feeding America is a website that has a locator where you can identify in your state where the food banks are and then also where local food pantries are.
Great. Thank you so much. We're here with Dr. Micheal Compton. We'll call him Michael, discussing all kinds of important topics related to all of us because we all need to eat, clearly. And I do want to talk about the concept of veggie smarts. What exactly does that mean? We know veggie and we know smart, but when you put them together, what is
Yeah.
that?
So Kimberly, I wrote a book, not as a psychiatrist, but as a lifestyle medicine doctor who's interested in nutrition and also a farmer. And it's about my journey of getting smart about all of our vegetables. It's partly, a memoir, if you will. It's a little book about a little farm, really. But I put forward the notion of veggie smarts, which is really about having a thorough understanding of our vegetables so that we can make our meals be more delicious and we can make our health to be optimized. It's about a commitment to yourself. It's about really knowing your veggies just as well as you know your meats and your dairy products and so much more. It's also about knowing how all of our different vegetables are related to one another and not related to one another so that we can make dishes that are going to be really nutritious because they come from multiple families of plants. Nearly all of our vegetables, and I could probably name 100 vegetables for you, come from just 8 families of plants from among more than 400 families of flowering plants. And so if we really understand our vegetables better, we can make really smart selections that are going to improve our health, across the veggies that we eat. That's sort of what Veggie Smarts as a concept is about. And in my book, I tell the story of building a small-scale organic farm and all of the trials and tribulations that come with that, as well as the successes. And I also, describe things like how to make your own healthy salad dressing and a bunch of other farmers' recipes. I talk about ultra-processed food, why eating local is so important. I, explain why our ketchup is made with GMO corn and our mayo is made with GMO soybeans and our underwear is made with GMO cotton. The book, yes, is a little bit irreverent, but it's also full of health advice that I'm hoping will improve people's diet and nutrition and overall health.
Awesome. And tell us the name of the book, please, and where people might be able to find that. It's out or is it coming out?
It's coming out on Earth Day, which is April 22nd. It's available, at Barnes & Nobles and Amazon.com, etc. And it's called Veggie Smarts. A doctor and a farmer grows and savors 8 families of vegetables.
Awesome. Awesome. So check it out, folks. You'll learn more about Dr. Compton Michael's work and also how you can be smart about your veggies. And I want to stay on that topic a little bit just because I get the impression that, especially with the American lifestyle, that people tend to lean more towards proteins, probably because they're like, calories, I need calories. And what is your, response to that as far as the vegetables being seen as like sides? You
Yeah. Well, in my book, Veggie Smarts, I say that some of the very healthiest meals are just sides. So one of my favorite things to do for dinner is to put together four sides. I call it a very square meal if it has four sides. And, we don't have to have an entree every night. In my view, some of the best meals are where we have lots of veggies. I'd love to have a sweet potato next to collard greens, next to pinto beans with some sliced onions on top, next to some roasted broccolini. That to me is a four-sided, very square meal with no so-called protein. And I do think, to get to your point about protein, we're all a bit obsessed with protein right now. I talk about it in my book, Veggie Smarts, about how we've sort of been bamboozled into this idea that we need to eat lots and lots and lots of protein. The reality is our calories from protein only need to be 10 to 35% of our total calories. And so we're pushed to eat protein. We see lots of health claims on cereal boxes and frozen pot pie boxes and so many ultra processed foods that really are not good for us, that they're high in protein, to try to entice us to eat them because we've been led to believe that we need to eat lots and lots of protein. The other thought in this area is that protein has been conflated with meat, but we can eat protein that's plant-based protein, as I mentioned earlier, like beans with rice, which is a complete protein that's much healthier because it has zero saturated fat, zero cholesterol, and lots of fiber.
I would imagine that the meat industry is behind the big push for protein. So
I would imagine that too.
back off, meat industry, and let the
Yeah,
veggies let the veggies get the spotlight, right? I did want to
yeah.
ask you though about your farming. Did you grow up in a farming family, or is it just something that you picked up on your own, or if you could speak to that?
I did. I grew up on a dairy farm in the southwestern part of Virginia. But, even though I loved the cows, I always loved the garden even more. And so I was born with two green thumbs that my granny gave me. And I love gardening and also farming, which means gardening, but growing that food for other people.
Awesome. And then I know that, before we wrap up, I do want to touch on a couple more things. And one is what you were talking about earlier and encouraging people to grow their own food. And I know for some people they have space for that, um, more space than others. And what kinds of recommendations would you have for people that have, let's say, more space in a backyard or front yard, and maybe for someone who wants to do like a patio garden or just grow herbs in their kitchen or things of that nature? How can you appeal to people based on their space and location and what they might have?
Yes, it's a great question. And there are so many resources available online. Anyone can learn how to grow some of their own food. I think it starts with really thinking through all of the vegetables and what do you most want to eat and therefore most want to grow. Is it cherry tomatoes? Is it a little patch of arugula? Is it snow peas? Is it so many other things? Really thinking through what you most want to eat, therefore you most want to grow, and then using some online resources or reaching out to a local farmer like myself to figure out how can you do this given your space? What are your local conditions? What is your growing zone? Do you have particular pests like deer in your backyard, etc.? Are you working with a balcony and how much sunlight does that have? So there are a number of things that you would need to address, but all of us can do it. We all used to grow our own food just some 200 years ago, and many of us can do it again, whether it's a really large garden in your backyard or just, a planter with herbs on a high-rise balcony. I think that
Mm,
we all can give it a try, growing some of our own food.
absolutely. And I'll just speak, to my own personal experience. We had a small patio garden a couple of years back, and we were able to grow because there was a fence. I grew tomatoes, cherry tomatoes, and green beans, just kind of up against. Looked at where the sun was, and it was just growing up against a wall, and it was I loved it. I didn't realize I was
Yeah,
gonna have that much fun doing it, but it was something that I looked forward to. Like every morning I'd wake up, the garden was completely different every morning. Something had changed, something had grown, a pest was there. But it was really, really exciting to see, my own food coming into being. So I highly recommend it. And no space is too small. You just have to really be creative, I think.
that's right. And it can also, as you pointed out, just really make you feel good about having accomplished something that you might not have been sure that you could do. And again, it's going to be the freshest, most delicious food that you can possibly eat if you grew it yourself.
Hmm. Awesome. And then let's see, I do want to get to another audience, another key pillar of the audience community, and that would be, state and federal legislators and people that actually are responsible for implementing policy or making those kinds of changes. And what types of advice or information do you want to impart to those types of people?
Well, we all need to be tracking what's going on with things like the Farm Bill, for example, which gets renewed about every 5 years or so. The Farm Bill is really, really important to health because it funds all of the USDA's food and nutrition assistance programs. So the largest is SNAP, Supplemental Nutrition Assistance Program. There's also SNAP Ed, which is an education program linked to SNAP. Many of us have heard of WIC. There's the school breakfast program, the National School Lunch Program, so many other federal food and nutrition assistance programs that are funded by the Farm Bill. So just to use the Farm Bill as one example, we should all be aware of the deliberations that are going on during the Farm Bill renewals, reaching out to our legislators and telling them what we care about when it comes to food and nutrition.
And so the Farm Bill, you said it gets renewed every 5 years. Do you know where we are in that cycle right now?
I think I'm not sure about this, but I think we're in a sort of stuck place right now. But presumably it will move forward eventually and will be renewed. And the key is how the next farm bill will look different from the current farm bill.
Mm-hmm. And speaking of that, you know, food and legislation, I wanted to ask you your thoughts about some of the some of the maybe perceived actions that I see being taken regarding food regulation. I know that there's some aspects of the government that are trying to, you know, deregulate some of the food safety standards that we have. And I get the impression that our food is probably some of the safest in the world. And I don't know why people would want to tinker with that. So if you can offer up your ideas or thoughts about that.
I agree completely. We're privileged to live in a country where we have a very, very high level of food safety. But the reason we have that is because the system is regulated. And so we would not want to reduce the regulations on the safety of our food. We also would not want to reduce people's access to federal food and nutrition assistance programs like SNAP and WIC. When any of us are hungry, all of us are at a disadvantage. When all of us are eating healthy and have access to healthy foods, all of us will do better. And so I think that food and nutrition security should be a bipartisan issue. All of us should be interested in everyone's access to healthy food, and hopefully it will be a bipartisan issue in the way that it has been in many, many years past.
Great. And then before we head out, one last question that just came to mind. I hadn't thought about this before, but how can, AI assist with this entire topic of food insecurity, nutrition security, spreading the word? Any thoughts about that? And how is AI actually working in the food industry overall?
Kimberly,
If
to
you
tell
know,
you the
and,
truth, no, I have no answer for that. I
and
have
I just
not
thought
thought
of it, so
about
no worries.
that, and I have no expertise in AI. I'm just a simple farmer focused on broccoli and Brussels sprouts.
Awesome. Then that's a great answer. For some reason, I just thought about that. So there'll be when we have you back on, we can we can talk further about that. All right. Great. And then if we could just wrap up and if you could tell, the general public the top five things that they should be really paying attention to as far as this topic.
I would say a focus on ultra processed food, what is and is not ultra processed food, with the goal of trying to eat less ultra processed food and more whole foods. I would say we all need to be focused on our country's rates of food insecurity and doing everything that we can to reduce the prevalence of food insecurity that affects so many, not just adults, but so many children. I would say, as I mentioned earlier, try to grow some of your own food and see what it's like for you. You might have green thumbs that you never even knew you had.
Mhm.
I would also say try to support local small farms and try to buy some or most of your produce from local small farms when you're able to do that.
Great advice, and I agree. You'll find green thumbs and green pinkies that you never knew, and it's a lot of fun to be able to see things come alive that you're nurturing. So I highly recommend people do that as well. We've been here with Dr. Micheal Compton with the Social Determinants of Health Network. We really, really appreciate having you on. I've learned a lot. You know a lot about this topic, and I appreciate it. And we'll have to have you back on and tell people again your book and where they can find it.
Well, thank you so much for having me. I've really enjoyed it. It's been great to talk to you. My book is coming out on Earth Day on April 22nd. It's called Veggie Smart. So check it out. It's a little book about a little farm.
Awesome. It's a great way to end this great conversation. And go out there, get some fresh, healthy food, everyone. And you can find out more about SDOH and go to their website. And also you can find out about Zoomcatchers in our network as well on our website. And we'll see you next time.
Thank you.